Well, across the country, states are reporting higher numbers of COVID-19 cases. But should we be scared of that spread? Here to talk more about those numbers is Dr. Scott Atlas from the Hoover Institute. Good morning, Dr. Atlas. Long time no chat.
Good morning. How are you?
I'm well, sir. All right, I'll say the numbers. Over the past 2 weeks, infection rates or positive test numbers are up 43%. ICU beds, supposedly in California, up a reported 37%. You look at those numbers, a lot of folks get scared. You get?
Well, I don't get scared when I do a more than superficial analysis of the numbers. And when you look all over at the states who are seeing a lot of new cases, you have to look at who's getting infected, because we should know by now that the goal is not to eliminate all cases. That's not rational. It's not necessary if we just protect the people who are going to have a serious complication. So when we look at the cases, yes, there's a lot more cases. By the way, they do not correlate in a time sense to the any kind of reopening of states. If you look at the timing, that's just a misstatement. That's a false narrative. The reality is they may correlate to the new mingling from protests and massive demonstrations. But suffice it to say that the vast majority of cases are in younger, healthier people. The overwhelming majority of cases, in fact, we know younger, healthier people do not have a significant problem with this disease, with the infection. 99% of people who get infected, in fact, have no significant problem with the infection. What we do know is that the death rates are not going up. Despite all the hand-wringing, that's what really counts, is are we getting people who are super sick or dying, and we're not. And when we look at the hospitalizations, yes, hospitals are more crowded, but that's mainly due to the reinstallation of medical care for non-COVID patients. When you look at Texas, 90+% of ICU beds are occupied, but only 15% are COVID patients. Well, 85% of the occupied beds are not COVID patients. So I think we have to look at the data and be aware that it doesn't matter if younger, healthier people get infected. I don't know how often that has to be said. They have nearly zero risk of a problem from this. The only thing that counts are the older, more vulnerable people getting infected. And there's no evidence that they really are. When you look at the data from all the states, which I've done, there's no data to say that older, vulnerable people are getting infected and dying. And then we look at a couple of other things, if I may continue.
Sure.
When you are hospitalized with COVID-19, we see the hospitalization length of stay is about half of what it was. We see the mortality rate for people who are hospitalized is 1/4 of what it was. What does that mean? That means A, we're doing a better job protecting the vulnerable, which is the goal. B, we're doing better at even treating people who actually need hospitalization. And then we have to look at two other points. It's anecdotal, but because it's hard to prove, but it looks like about 20 to 35% of people hospitalized as COVID hospitalizations are hospitalized for something else, and they just test positive. They're asymptomatic. They test positive for COVID-19, and they are then categorized as COVID hospitalizations. Even if you're coming in to have a baby, for appendicitis, for a kidney stone, if you test positive for COVID-19, you're called a COVID-19 hospitalization. I mean, that's misleading information. And again, it instills fear. The last point I want to make is that when younger, healthier people get infected, that's a good thing. Why? Why does that sound like a good thing? Because that's exactly the way that population immunity develops. When you have low-risk groups get infected, become immune, that is how you break up the sort of connectivity pathways to riskier, older, sicker people. That's what's called herd immunity. There's nothing wrong with having low-risk people get the infection as long as you protect the high-risk people, which apparently is being done because this explosion of cases has not caused increased deaths. That is de facto proof that we're not having a problem with more cases.
But Dr. Atlas, the critics will say, to your point of view, is deaths are a lagging indicator. Those deaths are coming in 2, 3, maybe 4 weeks out. You say?
Well, I say we don't have the definitive answer. I'm not going to make a prediction, or I'll be as bad as the people who are predicting things without knowing what they're talking about, the modelers. But suffice it to say that it's true. It's obviously a lagging indicator. No one would say it isn't. But so far, we have not seen that. We're not talking about cases that just started yesterday. We're talking about cases that started weeks ago. We're talking about the explosion of cases that started about a month ago. So I'm cautiously optimistic, let's put it that way, that we have not seen the death rates increase. Do we need to keep an eye on this? Yes, we do. I'm not saying we shouldn't be watching this, but I am saying that right now, I wouldn't be panicking at all. We have not seen evidence. In fact, by the way, if you look at the states with the more open policies, when you look at them, there's not a single one of those states in the top 15 of mortality per capita in the United States. Not one. Georgia's something like 16th, Florida's 27th, Texas is 40th. These are states that have been criticized for their reopening policies. There is no evidence that they are doing worse. In fact, they're doing better than most states.
Where's California on that list?
California, I think, is about 28th. I think they're immediately underneath or tied with Florida.
Interesting.
And California had a pretty strict lockdown, and I'm living in one of the strictest counties, Santa Clara County.
Yes, I know that, sir. You know, you've been a proponent. You first got on my radar screen when you started showing up on the Hill with your, hey, we got to get the schools back open. And you were citing the reasons why. And I only bring it up because I know you still believe that, but this just came down from the San Francisco Chronicle. 40 South Bay school principals are in quarantine after being exposed to a COVID-19 during an in-person meeting to plan to reopen schools in your neck of the woods. So,
well, so what? I mean, I don't understand that's not the problem. We're not educating superintendents of schools here. We're talking about the children. I mean, there's a couple things. This really needs to be said. It's not like, okay, let's stop schools. There's no problem with that. There's a huge problem with that. We're supposed to be educating the children. The schools are for the children. The children have virtually zero risk by the facts all over the world from a significant infection. They have zero risk of death. They have nearly zero risk of spreading infection even to their parents. This is validated all over the world by the facts. And we're sitting here saying, oh, we better close schools. Why? I mean, there's zero reason for this. If we want to protect the teachers in K through 12 schools, the median age is 41. That means half are younger than 41 in the U.S. 82% are younger than 55. For the rare teachers that are in a high-risk group, they can protect themselves. They don't know how to use 6-foot spacing and wear a mask if they want. Or if they're so afraid, they can stay home. They can stay home and teach from a distance. There's zero reason to lock down the schools when the children have no risk. The harms, by the way, are critical here to understand. We have in Boston area, 50% of students don't even log on. Distance learning is a failure. There's a 30% drop in reading level. This is also contingent on having what I call the paraphernalia of the affluent. Not everybody has it. Oh, they could just buy another iPod or iPad. And, you know, the other thing to understand is that we have child abuse going up. Okay, this is the unreported, heinous, egregious problem with closing schools. The schools are the #1 location where child abuse is reported. That's not happening if the schools are closed. The schools are where children learn, by the way, that they need a hearing aid or glasses. That's not being done. And so we have a 35% increase in the pediatric emergency rooms of serious child abuse. We're talking about people who bring their kid in to the hospital because they think they may have killed them or broken their bones. 35% uptick in that. We know that that's the tip of the iceberg here. When people lose their jobs, when they have problems at home with our serious financial problems, which have been caused by the lockdown, not the virus, the lockdown, child abuse is going way up. We're not even seeing it because the schools are closed. There's so many problems with keeping the schools closed, yet we're going to keep them closed when children have zero risk. Zero risk. We're going to keep them closed because of the rare teachers that are afraid to go in. That to me is really an outrageous abuse. It's really disgusting. I don't even know how to really fully explain how bad a decision that is.
All right, I feel your passion. On our next conversation, you're going to have to walk me through your life years lost equation as it relates to your theory that the shutdown has done more physical harm to our economy and more physical harm to our species than actually helped. The lives saved in COVID-19 pale in comparison to the lives lost because of the shutdown. That will be our starting point.
It's not a theory, by the way. One correction, it's not a theory, it's a fact.
Okay, so we'll pick up our next conversation. I promise that'll be our starting point, okay?
All righty.
Dr. Scott Atlas, everybody, from the Hoover Institute at Stanford University.